Agora sim, nós vamos convidar ao palco ele que é líder do Departamento de Auditoria Interna do Programa de Compliance de Cleveland Clinic. A organização, com sede em Ohio, foi eleita pelo 5º ano consecutivo como o hospital mais ético do mundo. Então, nós vamos convidar, para que possa também mediar nessa palestra, o vice-presidente do Instituto de Equalização de Saúde, o Giovanni Serri. E aí eu queria antes convidar, com os aplausos de vocês, para que venha a este palco, por favor, Dom Sinko. A gente vai aplaudir e recebê-los, e recebê-lo por gentileza. Lembrando, senhores, que é um oferecimento do Hospital Samaritano, a Braide e da Qualicorp, os nossos agradecimentos. E no final, nós temos aí também um momento de questionar e de perguntar. Por isso, nesse palco, Dom Sinko e, na sequência, a presença do Giovanni Serri, que também vai participar aí como nosso moderador. Please.
Good morning. I appreciate the warm welcome I've received here in Sao Paulo from Diagnostico Magazine, and all of you, thank you for being here in attendance. I'm here to talk about world-class compliance, and I understand here in Sao Paulo and in Brazil in general that there's a focus on developing compliance programs and making compliance more of a focus within your organizations. And I want to talk today about what we did at Cleveland Clinic to develop our world-class compliance programs. One of the things that we're very, very proud of at Cleveland Clinic is that there's an organization, a worldwide organization called Ethisphere, and they evaluate the compliance and ethics programs of companies around the world. And I wanted to show you, we're very proud that we're a 5-time winner of one of the world's most ethical companies as evaluated by Ethisphere. And it's something Cleveland Clinic is very, very proud of that we have. And I'm going to go through a lot of different things today. One of the things I'm going to leave you with is I'm going to walk through what it takes to develop a world-class program. So you could actually take the information that I'm providing you and take it back to your organization. And if you fill out and do the things that we talk about, you too and your organizations can develop a compliance program that you could be proud of as well. But the one thing that I have on the screen now that you have to understand is to have a qualified, good compliance program, it takes a lot of work, a lot of effort. It's not easy to have, and it takes a lot of organization. It's not something that you could just say, oh, we have great compliance programs, and then you have it. It has to be built as part of your culture, and culture changes are hard. It's hard to change the culture of an organization where compliance was not a focus, where things, whether it's corruption or fraud or other activities going on, it's hard to change a culture to being compliant. It takes a lot of work, but it can be done, and I'm going to provide the steps for you to be able to do that. But first, what I want to do is give you some background about Cleveland Clinic so you understand who we are, the size, and kind of what Cleveland Clinic is about. So what you can see here is that the size of the organization is we're at $6.5 billion, and this is US dollars. I think in the publication it said Brazilian reals, but size of organization is $6.5 US billion. We have about $11 billion of assets, 40,000 employees, primarily in Northeast Ohio in the United States. Although we are around the world, you'll see some examples of where we are across the world. We have 1,800 residents and fellows. So residents and fellows are the graduates from medical school that are training to be doctors, and we have 1,800 of them that we train at Cleveland Clinic. So the Cleveland Clinic is a developer of doctors, and we put them out into the United States. So it's an important part of our mission to develop future doctors, not only at the clinic, but throughout the country. We have over 6 million patient visits just at our facility alone. So we see a lot of patients. And we're also a very large research institution. We have over 4,000 research protocols that we do, that we currently have going on at the Cleveland Clinic right now. From a size standpoint, here's a picture of the clinic. If you can see, I'll point over here. This is our campus here, this size. So it's a very large campus, about 40 buildings, and this is just our main campus that we have, and I'll talk about our other facilities in a little bit. Those of you may not be familiar with Cleveland, Ohio, which is in the north central part of the United States, but this is downtown Cleveland. We're on Lake Erie, one of the Great Lakes, and this is downtown, and here is Cleveland Clinic here in the bottom corner over here. So we're probably about 5 or 6 kilometers from the downtown area, just to give you some perspective. The organization started in 1921, and it was structured as a group practice. So one of the things that makes the Cleveland Clinic different than a lot of hospitals is we are run by doctors. It is not run by business people who have relationship with doctors that come to the clinic. Our organization has 3,200 doctors, and they are the ones who run the facility. So it's basically a large group practice, and that makes a big difference because we're not hospitals employing doctors, we're doctors running hospitals. And so from a quality of care and a culture standpoint, it makes our organization a lot different. We have over 11,000 nurses and a little over 4,000 beds for our institution. We have about 1,000 beds at main campus Cleveland Clinic, but we also have 16 family health centers and 9 community hospitals that make up the Cleveland Clinic itself. And I mentioned that we're outside of not just Northeast Ohio, but we're also around the world. We have a facility in Florida, a facility in Las Vegas. We just opened a new hospital in Abu Dhabi in the UAE, and I'll show you a picture of that. It literally just opened in April. We have a facility in Canada, and we also have a hospital. We just announced last month we're opening a hospital in London, England, and I'll show you a picture of that. This is a picture of the hospital we just opened in Abu Dhabi, and you can't get a feel for the size, but if you look at from a facility standpoint, this is the hospital through here. This is the reception area. This reception area is the size of 3 football fields. So you put 3 football fields alongside of you. That's the size of the reception area, and this is the hospital. I think it's the largest facility, hospital facility in the world, and we just opened that in Abu Dhabi in April. Matter of fact, I'm going there in 2 weeks to help set up their compliance programs since they're a new institution. And this is a picture of the hospital, the building that we're going to be turning into a hospital in London, England. We just bought this last month, and we expect to open this in 2 years. So we do have a international presence as well. Some background from a quality standpoint, the U.S. News and World Report, which evaluates quality of hospitals, every year we're listed in the top 5. We're tied this year for 3rd, and we're usually, depending upon how the evaluation is done, is usually in the top 3 or 4 or 5. Ranked number 1 in the state of Ohio. And I won't go through all the specialties, but all of our specialties. Heart care, we've been number 1 in the U.S. in heart care for the last 21 years, and literally all of our specialties are nationally ranked. So from a quality standpoint, it's a high quality hospital. So let's talk about compliance and what we need to do from a compliance perspective, not only at the clinic, but for your organizations and for here in Brazil. So why have a compliance program? Why do it? Why is it important? And the reason I think it's important, and Cleveland Clinic thinks it's important, is because the compliance program is the foundation of an ethical company. If you don't have a strong compliance program, and I mean a formal program, then it's pretty hard to have a compliant culture, because it literally is the foundation. And why is that? Because in healthcare, particularly healthcare, but true in all industries, regulations are complex. So to make sure that you're complying with all of the federal and state and whatever your political organizations are here, in order to comply with all those regulations, it's complex. And doctors and nurses and regular administrative people, they don't necessarily understand all the regulations that have to be followed. So it's important to have a compliance program that leads people to do the right thing. And here's another thing to keep in mind with hospitals. Hospitals employ people. Unlike industry, if you look at a lot of industry, they've gone to computers, robots, they've taken a lot of people out of the process. And computers and the robots and stuff, they do the same thing all the time. Healthcare is primarily doctors and nurses, and you can't take them out of the equation. But what happens with people? People make mistakes. People are not perfect. You can want to be doing the right thing. You could be a very compliant, ethical person, but we make mistakes because we're people. So anytime you have an organization like a hospital or anything in healthcare, you're going to have situations where mistakes are made. That's not necessarily that it's bad or a bad organization, but a compliance program is important because it helps identify and correct those mistakes. And then with any organization and with people, you always have the opportunities for fraud. It's real, it happens, you want to minimize it, but you're always going to have a situation where in any large group of people, where you're going to have somebody who's not going to want to do the right thing. I mentioned at Cleveland Clinic we have 40,000 employees. One of the things I tell our CEO, Dr. Toby Cosgrove, who's our Chief Executive Officer and a terrific guy, very ethical individual, and I tell him with 40,000 people, I said if 99% of your people are doing the right thing and they're ethical and they're good people, 99% of it, if only 1% is doing the wrong thing, with 40,000 people, that means there's 400 people that aren't. So anytime you're dealing with people, you have the opportunities for not only mistakes, but for fraud, because not everybody wants to do the right thing. Always another thing to keep in mind about fraud, it's always rationalized. When somebody commits a fraud and they get caught, they always have a reason why they did it. In their minds, they've always determined why it was okay to do it. And even though it could be wrong, in their minds it wasn't. So it's real, and we have to understand that. And the other reason why you want a compliance program is because when you have unethical situations, fraud, or anything bad that happens, it has an impact on your employees. It impacts your company. It impacts the region in which you work. And I think you've seen that here in Brazil a few months ago with some large situations that I'm sure you'll be talking about later. But when you have a compliance problem, it impacts everybody. So it's important, to have a compliance program. And then you look at what's the value. So what value does that compliance program bring? Well, one of the things that it does is it proactively identifies problems. Again, compliance takes work. It's not something you say you have and you walk away. It takes work. But what it does is it identifies the problems and it gives you an opportunity to fix them before they grow, before they become bigger issues or problems. Now, one of the things that I like to say when I do presentations, I like to compare compliance and ethics to the medical side of the business. And I'd like to compare it to both preventative medicine and surgery. And I think this is a great analogy in that, surgeons, at least in the United States, they're generally the highest paid people. You have a problem, you have a tumor, you have something wrong, and you go to that surgeon, and the surgeons are high paid because they take care of the disease, they take care of the problem. So you look at that and say, wow, those people are important. Look at that. Just like lawyers in a compliance situation. I'm sure when you have a compliance situation here, you get the attorneys and you spend lots of money to fix that problem. But compliance is the preventative medicine. Compliance is, stop smoking to prevent lung cancer, so you don't have to have the surgery in the first place. Compliance is the preventative medicine of not having the disease, not developing the disease, so you don't need the surgeon, so you don't need to have the problem taken away. And generally, people don't focus on preventative medicine. Boy, when you have the surgical problem, you focus on that and you take care of it, but you don't focus on the preventative side of it. But that's what compliance is. We prevent the problem from happening, in the first place. And it also, when you have a strong compliance program, it also communicates to your employees, to your patients, to the community at large that ethics matters, that it matters to your organization to be ethical and to do the right things. And so that program says that you're willing to invest in a compliance program, and it shows these people that you're doing the right thing. And it also demonstrates to regulators, to the government, that you're trying to do the right thing, that you're trying to prevent the problems. It doesn't mean you won't have them, because like I said, problems are always going to exist, but you minimize them and you either eliminate them or you minimize the problems, and when they occur, at least the organizations, the community, the government knows that you were trying to prevent them in the first place. So it's important from that aspect as well. So let me talk about our organization now at the Cleveland Clinic and how to develop a good, strong compliance program. So this is our org chart. This is the organization chart for my office, and again, my title is Chief Integrity Officer. So integrity is really at the foundation at the Cleveland Clinic. It's one of our key foundation items is integrity, and to have a business with integrity. So my title is Chief Integrity Officer. If you look on the bottom, the two offices that report to me on the bottom are the offices of internal audit and the offices of corporate compliance. But the thing that's important about this org chart, that's important for a strong compliance program, is looking at my reporting line. My reporting line, if you look here, I report directly to the board of directors. I don't report to the chief executive officer. So if you look to the left, I have a dotted line to our CEO, our chief executive officer, Dr. Cosgrove. I report to him. My office is in executive administration, what we call the C-suite in the United States, where all the chief officers are. My office is located in the C-suite, right a couple offices down from our chief executive officer. My position demonstrates to our employees and to the government and to the outside world that compliance is important, because it's an executive position, and it's at the level of all the executives, and my reporting is to the board of directors. And so that sends a message. It also, from an effectiveness standpoint, is important, because what happens if in your organization the ethical problems are with your senior management, not with the people down below, but what if it's your executives that are the ones that have a problem with either ethics or taking kickbacks or anything like that? Well, if it's the executives that are involved and I report to the executives, well, how effective am I going to be? Because how can I tell on the executives to the executives? Because one of the things they could do very easily is they could just fire me, and then their problem is taken care of because I'm gone, and now they continue on. So it's very, very important that when developing a program, that my position, that you have somebody in charge of ethics and compliance, but that person reports to the board, so that if there's problems anywhere in the organization, if they're not taken care of, if they're not being addressed by management, I have the ability to go to the board of directors and report to them so that it can get taken care of. So that's critical. The other thing you see on the organization chart is the dotted line to the right to the Corporate Compliance Committee. And we'll talk about this as one of the 7 elements of an effective compliance program. But we have a Corporate Compliance Committee that oversees the compliance activities within the organization, not only overall compliance, but research compliance in all the regional hospitals. Again, Cleveland Clinic is a very complex organization, so we have a lot of committees. And I'll go into more details on that here in a little bit. So where I want to spend my time with you is what we call the 7 elements of an effective compliance program. And I'm going to walk through these 7 because this is what you'll want to do at your organization. If you implement these 7 steps, you'll be on your path to having a solid, well-respected compliance program. And this is basic, and it's important, and I'm going to go through each one of these in detail. It's important to have all 7, because if you're missing any of these 7, then you're going to have something missing that's going to make your compliance program less effective. And because of the importance, I literally want to walk through each one of these. So first of all, the first element of an effective compliance program is you need a compliance officer and a compliance committee. So I've already talked about what we do at the clinic. I'm the Chief Integrity Officer. I am the compliance officer for the entire health system, for the entire organization of Cleveland Clinic. And again, as I mentioned, it needs to be a senior executive position. If it's somebody down low, you're telling your employees it's not that important, it's a lower level position. It needs to be a senior position. It needs to be independent, so if there's any issues, I can go to the board of directors, or I can go to the government, I can go to the outside. It has to be that situation. Again, if I report to management, then how effective can I be if management is the problem? You have to have oversight, you have to have a compliance committee that oversees the compliance activities. So Cleveland Clinic, very large organization. We have 27 medical institutes. We have a heart institute, neurological institute, all the way down, urological, basically all of the diseases covered. And what we do is we not only have a corporate compliance department, and I have these departments that report to me, but we establish compliance committees within each of the institutes. So it can't be Don Sinko is in charge of compliance, because everybody has to be responsible for compliance. Compliance has to be cascaded down, throughout your organization. So we have compliance committees, smaller compliance committees in each of the medical institutes, so that they understand what they need to be doing in order to be compliant, what activities they're going to do, and I'll talk about those activities in a little bit. But there has to be compliance focus in each of the operations of the business that then roll up to the corporate compliance committee that then rolls up to me. So it can't be one person is responsible for ethics and compliance and everybody else goes around their business. No, it's got to be part of what everybody does. And you need to have a diverse background of people involved in compliance. Again, you can't just have lawyers or CPAs. You need to have doctors involved. You need to have the nurses involved. You need to have people involved that do the billing. You need everyone involved, because you could have billing problems where people are billing inappropriately. You can have problems with the quality of care and the like. So you need a diverse background of people involved. Again, not just lawyers. So that's the first. You need to have somebody in charge, and you need to have committees and a process. The second element of an effective compliance program is you have to have standards. You have to have policies. You have to have procedures. You have to have something that your employees know that this is what's expected of them, that this is what they need to be doing. And if you don't have standards or policies, then it's up to interpretation. People can interpret as they like. So you have to have these policies in a lot of different areas for compliance. Privacy and security, which in the United States, privacy, and we have our HIPAA laws that are protecting patient information. So when you look at hospitals and the information that hospitals have on each of its patients, cyber hackers, people that want to be able to steal your data to set up fake identifications, and whether to set up credit cards under your name or to take borrow money under your name or whatever. Medical records of each of our patients have all the information you need to steal your identity. Because on a medical record, you have your name. In the case of the United States, your Social Security number, which is your identifier number, your national identifier number. It has your birth date. It has your address. A medical record has everything that's needed to steal your identity. So cyber thieves would love to get into and break into hospital information just to steal identities. And I know in the United States that's a big problem, where people from other countries are hacking in, stealing data, and then using that data to steal the identities of people. So you need to have privacy and security policies and procedures that protect that information. Again, that's a pretty big compliance activity that we have. Same with documentation and billing. So when you look at the billing, and again in the United States, the way our billing works for patient visits, it's based upon the work that's done. So the documentation of that patient visit, what work was done, how the bill is developed, how either the government is billed or the insurance company is billed. You need to have policies and procedures that say, here's what we're doing to determine that we are documenting and billing compliantly in a compliant manner. And the same for quality and safety. You need to have policies and procedures over quality. How are you determining that the quality of care being provided is consistent and appropriate? And so you need to have policies along those lines. And then lastly, a code of conduct. And we at the Cleveland Clinic have a code of conduct. I think most companies I know in the United States have them. But what do you have in them? A code of conduct sets the expectations at a very high level of what's expected of that employee from an ethics standpoint, from a business standpoint, from doing things in an ethical and compliant manner. In the Cleveland Clinic, ours is a very short code of conduct. It's about 7 or 8 pages long, but it details to our employees what the expectation of them is and in following that. And if you don't set that up right at the start, if you don't set employee expectations that you want a culture of compliance and ethics, then how are they going to know that that's what that is? So a code of conduct is important. So the second element, standards, policies, and procedures. If you don't have them, how do you expect your employees to do what's expected of them? Again, from our code of conduct, we have 7 principles in it. It talks about compliance, ethics, conflicts of interest, appropriate use of resources, so they're not wasting resources, confidentiality and acting professionally, and your responsibilities. One of the responsibilities that we have at Cleveland Clinic is we tell employees, if you're aware of non-compliant activities, if you're aware of corruption, if you're aware of kickbacks, you need to let us know. You can't be aware of things and then keep it hidden or keep it a secret. If you're aware of it, you need to let us know, and we'll talk about how to do that right now. So the third element you get into is you need to have an open lines of communication. So employees have to know that if they're aware of non-compliant activity, ethics problems, corruption, there needs to be lines of communication that they can tell you. Because if you don't provide an opportunity for them to tell you, then how do you expect them to do it? A lot of times employees, because of culture, are afraid to talk about those things. They're afraid of retaliation. They're afraid that if they tell on something that's going wrong, that something bad is going to happen to them. They'll get fired or something will happen. And the last bullet point I have here is that one of the musts of a compliance program is there cannot be any retaliation against an employee who talks to compliance about issues. And that's something that's critical at Cleveland Clinic, that we encourage people to call us. The tone has to be set by senior management. Senior management has to say, we want you to come forward if you're aware of things that are wrong. We want you to tell us if something's going wrong. And it's not just senior management, but your middle management has to communicate that as well. You often hear about tone from the top, that the tone from the top has to be, we're an ethical company and we want to do the right thing. But I like to talk about the tone in the middle, because often it's your middle managers that are ones that are setting the culture within your organization or within that department. If you have a middle manager who's unethical or who suppresses information, it doesn't matter that the executives are saying do the right thing. The employees are responding to their boss, the people they report to. So you have to have a tone, what I call in the middle, that your middle managers have to be communicating to do the right thing, and they have to be wanting that, because if not, the employees will not follow. And then you have to provide the ways for them to do it. Obviously, we want our employees to tell their boss or to tell the senior executives if there's a problem, but often they're afraid to do that. So you have to provide, and we provide, and I think many companies do, ways for employees to report anonymously, where they can call. So at the Cleveland Clinic, we have an anonymous telephone line where somebody can call and they can report a problem, and they can talk about an ethics issue or a compliance issue, and it's anonymous. We don't know who called. We cannot follow that call. If somebody calls that number and leaves a message, we cannot trace it. We cannot go back to that. So if they don't leave their name or their phone number and they tell us what it is, they can report to us, and then we can go and investigate it, and we won't know who they are. So sometimes you have to be able to provide that anonymous line so people who are afraid to do it still have a way to do it. We also have anonymous email, where within corporate compliance, we have an email address that somebody can send us an email and report electronically a compliance concern. And it's anonymous. We cannot follow it back. We don't know who sent that. So hopefully we hope that the people call us directly and we can talk to them and we know who they are and we can ask follow-up questions. But if they're afraid to do that, you have to provide a way for them to report it anonymously to eliminate that concern. At Cleveland Clinic last year in 2014, we did over 1,000 compliance investigations, over 1,000. About 150 came in anonymously, but the others, over 900, came in directly where they call us. They feel comfortable at Cleveland Clinic that they can call me directly, they can call my staff directly, and they know that they'll be protected, that we're not going to, tell who told us what the thing is. We can go in and do the investigation and try to resolve the issue without getting them involved. So we're pleased that we have an environment at Cleveland Clinic where they feel comfortable, they can call us directly and we can talk with them and not have to be anonymous. But if you don't have that culture, or you're trying to develop that culture, having an anonymous line is important. Because you as a company, if you want to be ethical, if you want to be compliant, you want to know if something's going wrong. You want to know if there's concerns within an organization. You don't want to suppress them, because it's by identifying them and responding to them is how you get there. One of the comments I was saying yesterday to somebody that we have in the organization, this happened to me probably about 8 years ago when I was new to the position. But one of the things that you learn is people in your organization talk. They talk about you, they talk about your leadership. Whether you like it or not, they talk about all of us, and you don't know what they're saying. But one of the things, do you want them saying positive things about you, or do you want them saying negative things? And here's something that happened to me about 8 years ago that really, it was very important to me, and it's stuck with me all this time. So about 8 years ago, I had a nurse from one of our outlying areas, family health centers, call me, and she called me about 9 o'clock in the morning, and she told me about a doctor that she had a compliance concern about. She told me what, I won't go into the details, but she told me what he was doing, and it was not appropriate, and she wanted me to see if something we could do about it. So one of the things that I do in my role is being independent. When an employee reports something to you, you don't know whether it's true or not. You don't know if the employee is doing it because they want to get back at their boss, they didn't get a big enough raise, so they're mad, so they make something up and they report it. Or it could be that it's a real concern and that it's a real problem. And when you get the report, you don't know which one it is. So when I get a call or we get a report, we take all of them seriously, and you have to investigate it. And what we find is half the time it's not an issue at all, and half the time it's a real problem. But when you get the call, you don't know which one it is, so you have to take them seriously. So this nurse calls me at 9 o'clock in the morning, and she reports this activity of this one doctor. So I thank her for calling me. I told her that we'll investigate it. So I hang up. I call the doctor, and I ask him about this activity. I didn't say how I found out. I said, I understand this is happening, blah, blah, blah. Is this true? And he admitted it was true, that what he was doing was true. And I told him that, it was a violation of our policies and procedures, and that we were going to have to take disciplinary action. I called the human resource group over our physicians, told them what happened, and we took action against that doctor for what this doctor did. And we corrected his activities so he wouldn't do it going forward. At 3 o'clock that afternoon, I called the nurse back, and I thanked her for telling me about that activity. I told her we've addressed it and we've taken appropriate actions, and we appreciated what she did. And what she told me, I'll never forget. She said, "Mr. Sinko, I was told if I called you, you would do something about it, but I didn't know you would do it this quickly." And that's important, because what she said was, she said, "I was told if I called you, you'd do something about it." So people talk. Somebody told her, "Boy, if you call Don Sinko, he's gonna do something about it." So people talk about what you do and what you do, whether you like it or not, they do. So what happened, in a way, by taking it seriously, addressing it quickly, and then taking action, now not only did we take care of the problem, but we now had this nurse telling everybody about what happened, so then if another problem comes up, they feel confident that if they call, it'll get taken care of. So that open line of communication and then acting and taking them seriously is so very important, because if you don't do that, the talking will be, don't bother reporting because they're not going to do anything about it anyway, and then the ethical problems will exist. The next element of an effective program, and again, you have to have all of these. You leave one out, you have a problem. The next one, and this is critical, is training and education. So it's great, you have an officer, you've got policies and procedures, you have communications, but if you don't train and educate your employees on them, then what value is it? The employees have to know what to do. They have to know, what they are. So one, in new employee orientation, when you take on a new employee, how is it that you communicate what your compliance program is and what the activities are and what they need to be doing? Do you have annual training? In the United States, we're required to have annual updates where we have to go out. We do it electronically at Cleveland Clinic, where there's electronic online training where they go on and we can see who's taken it and who hasn't taken it. But you've got to train your employees and educate them. You've got to talk to them about fraud, waste, and abuse and why that's wrong. You have to talk to them about privacy and security and what's appropriate and what's not appropriate. You have to talk to them about quality and safety and what's appropriate, not appropriate. You can't assume that they're going to know that. So you do have to have training education, and it has to cascade to all employees, not just managers, not just senior executives. It has to cascade all the way down what those expectations are. And you can do that online, like we do a lot of it online, or we can do it in person. I do lots of presentations within Cleveland Clinic at least once a week. I do probably 60 or 70 presentations within the clinic, within our own people ourselves, just so that when you have it face-to-face, often it's more effective. And then you have the ability to ask questions. Just like when I'm done here, hopefully you'll have questions and we'll have time for you to ask me questions. So training and education is critical. Then the next element is auditing and monitoring. So now you have policies and procedures, you have officers, you've educated people. Well, how do you know that they're doing what they're supposed to do? How do you know that the people are following the appropriate steps? So to have an effective program, you have to audit and monitor. You have to determine that it's happening. One, because it'll demonstrate that it's happening, or second, if it's not happening, it's good that you monitored and found it and you were able to correct it and to be able to take care of it. So you have to be able to determine whether the program is effective. And the way you do that is, because we go, well, what do you audit? What do you monitor? What should we be looking at? Well, an important part of the program is doing a risk assessment. Where are your greatest compliance risks in your organization? Where are the greatest ethical risks in your organization? We at the Cleveland Clinic, we do an annual risk assessment. So we sit down annually within compliance and audit. We meet with all of the medical institutes, and we talk about risk. We ask them, where do you see the compliance risks? Do you have certain employees that may be compliance risks? Where do you think problems may be? And depending upon that risk assessment, we then determine here is where we're going to audit and monitor. Often it's in the most complex areas, because the most complex areas are, have the greatest chance for errors. Not only fraud, but just in areas for errors. And so we do that throughout the department. It's not just us doing it. We involve all of the medical institutes as well in that process, so that we then audit and monitor. And if we find out everything's going well, then we've documented that we're doing the right things. If we find problems, we have the opportunity to correct them. Because again, the value of a compliance program is identifying the problem before it gets to be a bigger problem or it gets to be a national problem. Then the last couple elements are also important, and this is one of the things that the outsiders and that your employees look at. So this element is called response to defective deficiencies. So how do you respond? An employee brings a problem to you, or your auditing and monitoring activities uncover problems. So what do you do about them? Because if you don't do anything about them, how are you going to have an effective program? If you find problems and you just leave them, or you cover them up, you don't have a very effective program. So it's important that you take them on. The example that I gave you, when the nurse called me with a problem, I took care of it that day. That happened to be something that I could do fairly quickly. Some of them I have to go to my department, and we have a team. I have 15 people in my compliance department that investigate these issues. They do the auditing and monitoring, and they investigate issues. So you have to have a department of people that do this. It can't just necessarily be one person. But we have to, when we go through and do this and we uncover something, it may take time. It may take a week. It may take 2 weeks to investigate. But do you investigate? And how do you respond to the problem? Do you take action? Do you fix it? Because like I said earlier, employees are watching how you respond. And they're watching you. Regulators are watching you and how you respond. Because if you ignore it, or you cover it up, you don't have an effective program, and you're in much bigger trouble than just the problem itself. And I think you see that, we see that in the United States, you see that here in Brazil, when there's things that are covered up or hidden, when they finally come out, they become worse than ever. So responding is critical. How do you respond to those? And then here's the last of the 7 elements. And again, very important. All 7 elements are important. And this is consistent enforcement of disciplinary standards or actions. So now that you've uncovered it and you responded quickly, what disciplinary action did you take? If you just slap somebody with an expression, slap somebody on the wrist, if somebody does something bad and you just say, oh, just don't do that again, you're telling your employees, well, nothing happened. They violated the law. They violated policy, and nothing happened. They just said, oh, don't do it again. So if they see that, they go, well, we might as well violate policy or violate the law because nothing's going to happen to me. So you have to take action. You have to have disciplinary standards. And whether that's, having a written warning, for potential termination of the employee, it could be terminating the employee, it could be prosecuting the employee, putting the employee in jail. We've had Cleveland Clinic employees who've committed fraud who went to federal prison. At Cleveland Clinic, we will prosecute employees if they violate serious laws, commit fraud against the organization. We don't just say, oh, don't do it again, or some organizations will fire the person and just get rid of the person. At Cleveland Clinic, we prosecute. We'll send people to jail if they commit fraud, and our employees know that, and so they know that we take these things we take these seriously, and it has to be consistent disciplinary standards. So you can't say, oh, if a nurse does something, we're going to terminate, but if a doctor does something, we'll just say, don't do it again. No, you have to be consistent. It can't be higher level employees can get away with things and lower level employees get more serious action. It has to be consistent. So those are the 7 elements, and it's important to understand those 7 and that your program knows that it has those 7. And this is another slide, my second last slide here, that for governing boards. So if you're a board member or your organization has a board, or you're in a position where you oversee operations, the United States government in April of this year came out with guidance for governing boards. And I wanted to share this with you because, again, they said here are 4 main areas that board of directors should understand about their compliance programs. And I have green check marks next to each of the 4 because when this guidance came out in April, Cleveland Clinic was already compliant with all 4 of them. We didn't have to do anything different because our program, again, we feel we have a world-class program. We were already there. But what the government said is, do you understand the roles and relationships between internal audit, corporate compliance, the law department, human resources? Are they all involved in the compliance program? But it also says, is your compliance department independent? Is it independent of the law department and not part of the law department? Is it independent of human resources and these other areas? And ours is, as you saw in our organization chart, we are an independent organization. It says, do you have a process in place to have issues reported? And we do, and we talked about that, about the anonymous reporting lines. It says, do you have an approach to evaluate risks of noncompliance? And we talked about that, about having a risk assessment, looking into your organization. Where do you have the greatest chance of noncompliance? Or where do you have the greatest chance of fraud within your organization? Are you evaluating it and are you looking at that? And then do you have methods to encourage enterprise-wide accountability, that everyone is involved in the organization, not just 1 or 2 people? And we talked about how in our situation, we cascade the compliance department down through the institutes. Everyone's involved. Everyone's involved in the risk process. Everyone's involved in the auditing and monitoring. So our government, said, here are the 4 things that you as a board of directors should be asking about. And our board already knows this, and we are already there. So that's, I wanted to provide you, that's kind of what we do at Cleveland Clinic for our compliance program. And again, we're very proud of the compliance program that we have, But in summary, the points that I have here, keep in mind, a good, solid compliance program takes work. It's not easy. It takes an organization. It takes all of the things that we just talked about. But it's also the foundation of a good, ethical, and compliant organization. And keep in mind, this is something, it's true worldwide. Employees want to work for an ethical company. Employees want to work for a boss who's ethical. They want to work for people who they know are trying to do the right thing and that are good people. People do not want to work for somebody who's involved in corruption or who's unethical in nature. So by having a solid program and by having this type of culture within your organization, you become an organization that you retain employees, you retain your good employees, and you attract employees. We have people who want to work at the Cleveland Clinic because they know it's a great place to work, and they know that they'll be working with good people. So we can attract good people, and we get to keep good people. And again, keep in mind, as I said, employees follow the lead of their bosses. They watch you, they know what you're doing, and they talk. So when you work in a compliant manner and you're ethical, your people see that. And if you're not, your people see that as well. And then you leave yourself open too for your own problems. So with that, that's the conclusion of my formal remarks. I'd be happy to take any questions that you may have. I don't know if we have time to take questions. Yes.
Can you choose to?
Oh, she said. Oh, sure.
We have a question for you. Thank you very much.